Welcome everyone, it's great to have you here. And as Bronwyn said, my name's Sarah Pryor and I'm the Director and Course Coordinator for all of the Healthcare Redesign courses. So I'm going to talk to you today about healthcare redesign in general and also current opportunities for studying healthcare redesign within the University of Tasmania. But before I get started, I would like to acknowledge my local Aboriginal community, the Palawa Pakana people. I'd like to offer my thanks for the care of country for thousands of years and pay my respects to their elders and ancestors and their legacy to us. I also wanted to note the important role that Aboriginal people play in the development and the improvement of our healthcare systems and processes. So what is healthcare redesign? Well, as it sounds, it's redesigning of healthcare systems and processes. So it's really an evidence-based approach to health service improvement based on processes that have previously been used in manufacturing, in transport and in aviation. So you might have heard of lean thinking or theory of constraints. There are a couple of approaches that we use within healthcare redesign. So these processes have been adapted for use in healthcare and we now collectively call them healthcare redesign. So healthcare redesign is what we call a systems-based improvement methodology, focusing on improving existing services and processes with current resources through meaningful and sustainable change for better health outcomes. So these outcomes can be for patients, for families or supporters, for staff, for services and for organisations in general. And it includes a range of outcomes such as clinical outcomes or economic outcomes, for example. The thing that really sets healthcare redesign apart from other approaches to change or improvement is that redesign assumes we don't know the solution to a problem that we've identified. So redesign has 5 distinct phases where we start with identifying what the problem or problems actually are and mapping the process around that problem. So that might be looking at a patient journey or looking at an administrative process. So an example of a problem that we might look at in healthcare redesign is something like current systems and processes for communication between clinicians seems to have a detrimental effect to the patient journey, resulting in long delays and potential for adverse events. So that's a very general problem, which could apply to many different systems and processes in healthcare. But that's the sort of thing we start with when we start healthcare redesign. So we then undertake what we call a diagnosis of that problem. So looking at what evidence there is to support the problem, to ensure that we have a really good understanding from a range of perspectives about what is currently happening within that system or within that process. We then use that diagnostics information as well as a range of engagement strategies and tools to develop evidence-based solutions to that problem that we've identified. So a very systematic approach. And then the following 2 phases are the implementation of those evidence-based solutions and the evaluation of the outcomes short and long term of implementing those solutions. So that was just a very brief overview of the healthcare redesign process in general. And the University of Tasmania offers a graduate certificate in healthcare redesign, which is a project-based work integrated learning course where you will actually undertake an improvement project fully supported within your own workplace. So this particular course is the first of its kind in Australia. We've been delivering this course since 2016, and students within the course come from a wide range of disciplines across healthcare. So at the moment, we have students from nursing and allied health, from medicine, from administration and leadership, from pharmacy, radiology, from IT, business, oral health and paramedicine. So I'm sure there are many more disciplines, but at the moment, they're the sorts of students we're working with. And within the course, we're aiming to build your skills and your knowledge within your workplace, but also with a transferable skill set across healthcare more broadly. So we're aiming to give you the skills to create positive change within health services, not to health services. So we work with our organisations, and that means that we can make meaningful and sustainable change while also providing students an opportunity to gain that postgraduate qualification, so the graduate certificate. So the healthcare redesign course or the program overall is set apart really by the way in which we deliver and also the outcomes that we can achieve. So students who undertake our courses develop redesigned skills based on methodology that has had proven outcomes for organisations, also proven outcomes for staff, and of course for patients and their families. As a teaching team, we fully support each student through their individual workplace project. So something that they've identified as a need in their work area and something that also aligns with their organisation or departmental strategy and values. So the course is delivered in what we call a blended model, which is a combination of online learning, workplace learning, and optional face-to-face learning. So the graduate certificate course consists of 4 units, which I'll go through in a bit more detail in the next slide, excuse me, and can be completed in 1 to 2 years, depending on whether you choose to study in all 3 semesters. You can complete the course fully online, and as I said, there is the option to participate in face-to-face days where they are offered. So this slide gives you a bit of an overview of each of the units within the graduate certificate. So the first unit is an introduction to healthcare redesign theory and approaches. It looks at change management, leadership and systems thinking more broadly. And the following 2 units, so CAM 509 and CAM 510, are our project units. So this is where you'll delve into those 5 phases of redesign and actually complete a redesign project. So these are also the units that have the optional face-to-face masterclasses, but these are also provided online for students who are unable to attend face-to-face or if we're not offering them in your area. The final unit in the grad cert is fully online again, and it focuses on translation of research into practice. So this unit looks at implementation science and how we can successfully translate knowledge into practice in healthcare. So as I've mentioned, we do offer those face-to-face learning days based around the project units for any organisations that have 10 or more students enrolled in the course and where 10 or more students accept an invite to that face-to-face masterclass. So generally we run these classes in Brisbane 2 to 3 times a year, in Sydney 2 to 3 times a year, and in Tasmania 2 to 3 times a year. But we are certainly open to travelling elsewhere if we have a group of students that are able to come along to those face-to-face days. So the Healthcare Redesign teaching team, a pretty passionate group of educators, which I think is one of the reasons that we work so well with our industry partners. So we really care about improving service delivery, experience and outcomes in health. And as part of that, we really want you to get the most out of this course. So we provide a lot of opportunities for in-depth discussion within those units around your projects or one-on-one with our teaching staff to really set you up for success within your work integrated learning project. As previous clinicians, we also know how important it is to actually learn while you are doing in healthcare, and that experiential learning is really valuable for problem solving in particular. So the teaching team includes a midwife, a dietitian, a stroke research fellow, and 2 virologists, which is purely by coincidence. So we do have a bit of a wide range of clinical skills and clinical knowledge. I thought I'd just provide some examples of some of the projects our students have done over the past few years. So some of those graduate certificate projects we've seen from students include things like working with patients to redesign postnatal depression education, redesigning the process for OT rehab referrals, delivering optimised nursing and midwifery recruitment strategies, and improving access to addiction substance use services. And there's obviously a lot more examples there. So as I said, we've got students from a really wide variety of areas, and you can see these projects are quite diverse and tailored to meet the individual needs of those students in each area. And that's one of the reasons why this course is so valuable for healthcare professionals. So in terms of study pathways, we recommend our students study 1 unit per semester. There are 3 semesters in the year for our course. So semester 1, which starts in February, semester 2, which starts in July, and we have what's called a spring school extended semester, which runs from early November until late January, early February as well. So if you study in all 3 semesters, you can complete the graduate certificate in about 18 months, which is great. The study load for each of our units is approximately 8 hours a week. There will be some weeks where it will be a little bit more than that, depending on where you are with your project, but also some weeks where there'll be significantly less time required. And if you are in a department or an area where you want to undertake one project as a group, we do allow group projects. We just scope them so that they're a little bit bigger, so that each participant within that group still does the same amount of work as our individual project students. So currently we offer fee waiver scholarships for a number of organisations across Australia. All of that information can be obtained from us if you were wondering whether your organisation has that in place. And any out-of-pocket costs for our courses can be paid upfront for each unit or can be accumulated using HECS or Help Debt system. And for anyone who might be interested in learning a little bit more about healthcare redesign without applying to go into a full postgraduate qualification, our team has a free online course which is available at any time for anyone. So this MOOC, or the Massive Open Online Course, is worth 18 hours of CPD as well, which is a bonus. And we suggest it takes about 6 weeks if you're doing about 3 hours a week of study. So once you enrol in this course, you will have access to all the content forever. It doesn't expire. There's no time limit on it, and you can enrol at any time. So I highly recommend having a look at the MOOC if you are interested in the course, as it will give you a really good overview of what to expect as part of your redesign journey. And I just wanted to mention as well, we do have 3 levels of qualification within the Healthcare Redesign program. So the graduate certificate, which I've talked to you about today, we also have the graduate diploma and the Masters in Healthcare Redesign. All of our courses are delivered online with the optional face-to-face days provided at the grad cert level. And the grad dip and Masters degrees focus a little bit more on the evaluation of health service improvement with coursework and research pathways, depending on what your interests are in that area. And if you have any questions or queries about anything to do with healthcare redesign or the healthcare redesign program or approaches to change health service improvement in general, please feel free to reach out to me or the healthcare redesign team at any time. Thanks, Bronwyn.
Thanks. So we'll open it up for questions now. I'm just going to go through and allow everyone to click a button that allows people to talk if they would like to. You now should have the power in just a moment to do that. And the other option, of course, if you are feeling a little bit shy, is that you can use the Q&A button down the bottom of your screens. So I think everyone should be. Does anyone have any questions at all? I will just mention while people are getting their questions together or potentially typing them in. Oh, fantastic. We've got a couple in the Q&A. Oh, so yes, Wendy has asked where do we confirm the cost? So the partner agreements that Sarah mentioned are available on our website. So in the follow-up email to this webinar, I'll make sure there's a link to that. It depends where you work as to what level of subsidy is available, but we can send you through some more information on that. And there's a question for you, Sarah. Could you please talk some more about the Masters of Healthcare Redesign program?
Yeah, sure can.
An overview of that one.
Yeah, no problem at all. So the Master of Healthcare Redesign is essentially a 3-year degree. So there's 4 units in the grad cert, which is the first year. There's 4 units in the grad dip, which is the second year. And then there is the option to undertake a coursework pathway or a research pathway for your 3rd year. So if you undertake a research pathway, you'll be doing a 12-month research project. If you undertake the coursework pathway, you'll be undertaking 2 units and a capstone unit at the end of that as well. You will come with your own projects into the Master of Healthcare Redesign. So we don't decide what you do. You come with something that's relevant to you in your workplace, and you'll be allocated a supervisor across that degree to work with you to complete that.
Fantastic. Thank you. Someone else has asked if we could put the slide of the projects back up, and so we've done that, but please ask any follow-up questions that you have about those, or you're welcome to just pop your mic on and sing out some questions. We've also had another question from Jade, wondering if the course covers PDSA, Six Sigma, and Lean methodologies.
Yeah, thanks, Jade. So the three main methodologies that we use in redesign are Lean, Six Sigma, and the theory of constraints. We do also cover a range of quality and safety frameworks such as PDSA and some other change management frameworks as well. So there is an opportunity to learn about those. And as part of your project, we do expect that you apply those frameworks and methodologies as well. So you will get some really hands-on applicable learning in that space.
Okay, fantastic. So that goes through all of the questions that we had open. So unless anyone else wants to pop anything else into the Q&A button or turn on their mics, well, I'll assume that Sarah's just been incredibly thorough in her presentation. We'll be emailing out some more information about those fee scholarships that we offer, as well as links to all of the programs. Oh, great. And we've had somebody ask if there are any projects in aged care.
We haven't had a lot of students through the aged care sector, but there is absolutely scope to do a project in aged care. So yeah, that would be fantastic. We'd like to work with some people around aged care.
I do have a question. This is Rija.
Yes, go for it.
With the projects, do we have to show the budgeting process too when we do a project?
So with healthcare redesign, generally you won't have a budget because we work within existing resources. So we're not expecting you to have funding or to be able to source money or other resources as part of your project. We teach you the skills to be able to redesign systems and processes with existing resources, so what you've already got. If your project does require those resources, we can work with you around that.
Okay. Also, will there be Zoom or Teams classes weekly or in certain intervals?
Yes, that's right. So all of our online learning is run through readings, which are on our learning website, and we have webinars weekly or fortnightly, depending on the unit, which are recorded and optional to attend live. So yes.
Thank you.
Fantastic. We've had one very easy question from Anne, who said that she was late and can she access the PowerPoint? What we'll be doing is sending out a recording of the presentation, so you'll be able to see everything there. And then we've also had Scott ask if, Sarah, you have any tips on choosing a research-based versus a coursework-based master's, and what are the pros and cons, really?
Thanks. Hi, Scott. Nice to see you there. It really depends on what you want to do with the masters. If you have a big project that you particularly want to work on, I would suggest doing the research pathway. The coursework pathway gives you a little bit more of a broader scope of learning. So there are a range of elective units that you can do, from global health systems, public health leadership, advocacy and economics, and then one capstone unit where you'll do a small project. So yeah, it's really about what's going to work for you in terms of what you want out of the course.
And we've had another question about New South Wales health workers. The course wouldn't be free for New South Wales health workers, but we do have a scholarship in place. I'll just find the link to it and give it to you. Otherwise, it will be in the follow-up email. So yeah, it would be subsidised for New South Wales Health, but we do have an agreement. And we've had someone else ask if most of these projects, I'm assuming, are within the hospital itself, and do we cover administrative type issues, projects like data collection and costing?
Absolutely. We have a lot of administrative projects come through. A lot of them are based on processes that need to be redesigned to improve patient outcomes. So indirectly related to hospital processes, but yes, administration definitely.
Great. So I will just wait one moment to see if anyone else has any more questions. questions. I will get back to Meryl, who asked about New South Wales Health. I just need a moment to find that link, but other than that, we might wrap it up. If anyone thinks about anything else that they would like to find out more about this course or need any help with the application process, anything like that, you can just reply to any of the emails that you've received about this webinar, or you can reply to the email that you get about the recording and we'll be able to help you there. Hopefully we'll be welcoming you all as students in 2025, but I'd just like to take a moment as well to thank Sarah so much for her time today in explaining the course to everyone, and I hope that you all found it useful.
Thanks, Bronwyn.
Thanks. Okay, well, goodbye everyone and enjoy the rest of your lunch breaks.